I'm Laurel Joliff. A lot of people call me LJ. And I am here in Calaveras County. I've taken care of a lot of people in the foothills for several years, 15, I believe, regarding Medicare, all things Medicare. I've been doing it a while, and so I've kind of got quite a few people on my radar. And so every year between October 15th and December 7th, that's what's called annual election period, or AEP, I talk to several hundred people about changing possibly their prescription plan and or their Medicare Advantage plan, depending on where they live and what they have. And so I'm a licensed sales agent in California and many other states, and I don't ever tell you what the best plan is. You tell me what you want. It's my job to make sure you understand what your options are. I go over Part A, Part B, how much they're going to cost, when they start, how to sign up, lots of fun stuff. And then I also talk about Part C, which is Medicare Advantage, and Part D.
And I'm going to stop you there, but you give us definitions for all this.
Absolutely. Yes, I sure will. So Part A is hospital insurance and a few other things like hospice, among others. Part A is usually free for most people. And Part B is doctors, and then a few other things like durable medical equipment, not skilled nursing, but there's a few other things that Part B also covers. And that, for most people this year, is $164.90 a month. That's going up next year. They think it'll be right around $175, but it's not confirmed yet, so don't quote me. We'll find out at the end of December what the actual premium is for Part B for next year, okay? And so when someone has, it's called Original Medicare, A and B, they have a couple choices. They can add a drug plan to that, which I do recommend. That's also called Part D as in David. This year, there are 26 different plans in the state of California for Part D. What I recommend you do is we go to Medicare.gov. You can do this yourself, or I can do it for you. I do it for many. We go to Medicare.gov and we put in your zip code and your prescriptions and the dosages and where you like to pick them up if you prefer mail order or CVS or Rite Aid or whatever. We note that. And then Medicare.gov is going to tell us which prescription plan of the 26 are best for you, is best for you. And if it's a plan that I am authorized to write, then we write it, if it's the right time frame. If you'd like, you can sign up yourself. The benefit of using someone like me is I can help you and advocate for you if there's a problem. And I do that quite often. I do a lot of three-way phone calls with doctors' offices and pharmacists to make sure that you're getting what we expect you to get. Sometimes there's something called human error, and we get it fixed. And so that's the advantage of using someone like me. My commission is already made within your monthly premium, and so whether you use me or not, you're paying for it. Might as well get what you pay for, and that's me. So that's Part D as in David. If you have Original Medicare, you can get the Part D, and then you can get a Medicare Supplement plan, also known as a Medigap plan. There are many Medigap plans, A, B, C, D, F, G, K, L, M, and N, and depending on your age and when you got Medicare, will determine whether or not you can have all of those choices. Most people that turn 65 before January 1st of 2020 can get a Plan F if they would like one. If you had Medicare after January 1st of 2020, F is not an option. And so then Plan G becomes the one that's most comprehensive for you. Plan F and Plan G are the most expensive of the Medigap plans because they cover the most, okay? if someone wants to be able to go to any doctor they want nationwide, they get a Medigap plan, and they can do that. So that means there's no network of doctors. You never have to say, do you take my plan? Because Medicare has told doctors, if you take Medicare, you take all Medigap plans, as long as you're accepting new patients. That's the only exception to that rule, okay? So if someone is doing a lot of traveling, or if they're doing seeing a lot of specialists, or they want to see a lot of specialists, a Medigap plan may be their best option, as long as, of course, they can afford it, okay? So the other option is called a Medicare Advantage plan. The Medicare Advantage plan is also called a Part C, as in Charlie, and a Part C includes A and B, and that means you're still paying that $164.90. And most C's include the D as in David. And so a Medicare Advantage plan are county driven, and so it matters where you live. Calaveras this year in 2023 has 2 Medicare Advantage plans, and it's the first time we've had Medicare Advantage plans in probably 10 years. So it's a big deal. The 2 Medicare Advantage plans that Calaveras has are PPOs. They are either HMOs or PPOs or things like that. So that means there's networks of doctors that they need to stay within, or they pay more to see an out-of-network person, but they are able to because it's a PPO or preferred provider organization. So that's how that one works. The Medicare Advantage plan, as I said, is county driven. So that means San Joaquin County has a ton of plans. Stanislaus has a ton of plans, so does Sacramento County. Tuolumne has just a couple. Amador has just a couple, as do we. Okay? In the next couple weeks, we're going to find out what's available in 2024 in Calaveras and the other counties.
Now, with the Advantage plans, do you also get dental and vision?
That's a great question. Some Medicare Advantage plans include dental and vision and some hearing, but they don't have to. The way I recommend it is you do not want to choose a Medicare Advantage plan because of the dental, ever. These are doctor and hospital plans. They're not dental plans. It's just an added bonus. If someone gets a Medicare Advantage plan because of the dental, they're disappointed. In some counties, there's one dentist that takes everyone, and that's hard to get to. And so I do not recommend the dental being the reason why you choose a plan. But they do offer some. Some of them are offering fitness benefits. They all have 24/7 nurse lines, so you can call and ask a nurse a question, which is wonderful in the middle of the night. Some of them offer over-the-counter benefits, and so that means you can buy your aspirin and your toothpaste and things like that and get a benefit, but all plans are different. The more plans there are in a county, the more competitive they are, right? So San Joaquin County has a lot of plans that offer a lot of little perks because they want the business there. Calaveras has 2 plans this year, and so they're comparable to each other. One is Humana and one is Anthem Blue Cross this year. And in a couple weeks, I'll be able to talk about next year. So any questions so far?
Yes, the prescription plan has the enrollment period of October to December.
October 15th through December 7 is the time that you can choose a Medicare Advantage plan or a prescription drug plan.
But then if you're going to do not an Advantage plan, but stick with your original Medicare, your gap insurance, your prescription, then the prescription period is October to December. But if I want to stay out of the underwriting clutches, I have to change my Medigap plan within 60 days of my birthday every year?
So you're mostly correct. So again, your drug plan you can change between October 15th and December 7th only. That's the only time you can change a drug plan or a Medicare Advantage plan. Your Medigap plan, your Medicare Supplement plan, your Plan G, you can try to change anytime throughout the year. There's no open enrollment period. However, because we live in California, we have what's called the California birthday rule. And what that's referencing is you can change to an equal or lesser plan with no underwriting right around your birthday. Now, all companies have different birthday rules in California. So that's my job, not yours, to make sure I know. In fact, I have them all listed on my phone. So some are 45 days before your birthday, some are 30 days after your birthday, some are, it's ridiculous, but they're all different. And so that's why I have them down. And so what I tell folks is call me a month before your birthday and I'll go shopping. That's what I do. So if you have, let's say, an AARP Plan G and you're 66, because you got it last year when you turned 65, you can call me a month before your birthday and you're going to say, I want the best priced G available to us. And so I go shopping for her or him. And we'll find out Anthem Blue Cross or Blue Shield or Physicians Mutual might have a less expensive Plan G. So the Plan G is a G is a G is a G. They're all the same. The difference is the price and the customer service. Okay? So yes, you can shop anytime to get a different supplement plan throughout the year, but you will be underwritten. So what that means is I'm going to ask you some health questions. What prescriptions do you take? When was the last time you went to the doctor? Have you spent the night in the hospital recently? Those kinds of questions. And then the company can say yes or no, depending on your health, depending on your level of liability. But right around your birthday, they can't say no. And so that's why the California birthday rule is just in California. There's a couple other states that do it, but not many. And then you can take advantage of it because all Medigap plans are priced based on your age and your zip code. So that means every year you get a letter that says, happy birthday. Your new rate is, okay? And then they also say, this is your open enrollment time to shop because you're in California. But you will know what you're going to pay when your birthday's next month because they will have sent you a letter to just warn you that your new rate will be XYZ. Some companies offer a household discount for the Medigap plans. Some you have to have the same plan. Blue Shield is that way. AARP, just as long as you're in the same household and you both have AARP supplement, you get that discount. Physicians Mutual, as long as you're living with someone over 50, it doesn't matter if they're on Medicare or otherwise, you get a household discount. So all the companies are different. And again, that's my job to make sure I know what I'm talking about when we talk.
Well, that's really interesting.
Does that help you?
Well, it does, because I had been trying to figure out why my Medigap insurance increase seemed to just land at this odd time. It didn't seem to connect to anything, but now I understand what they're doing.
Well, all Medigap plans can go up twice a year. Once for your birthday and once for their annual rate adjustment. So they can go up twice a year. Doesn't mean they always do, but they can. Okay, that's important. The other important factor, and not many people pay attention to this, agents included, it also matters when the age increase stops. For example, I'm going to do this kind of off the cuff, but I'm pretty sure I know what I'm talking about as far as companies go. For example, Blue Shield, and I want to say Anthem Blue Cross, never stop the age increase. So that means when you're 90, 91, 92, they're still increasing. AARP stops at 75. That's a big deal.
I know where my business is going.
What's that?
I said I know where my business is going.
Well, I mean, and they're kind of a well-oiled machine.
Yeah.
They know what they're doing, and they want to keep you. They all do. Physicians Mutual stops at 80, I believe, but their rates are a lot less than AARP. And so, and it's so funny. People say, oh, I don't want to go through that hassle. And I'm like, I'm the hassle. I'm the one that's doing the work. Let me do it for you if you want to reduce your costs. And so, but it is a hassle factor for you. Even though I do all the work and it's a guaranteed issue, that means you get to change cards in your wallet and make sure the physician's office sees your new card, things like that. And you get to cancel the other one, which no one likes to do. But it's important, and you can save some substantial money sometimes depending on your age. Now, we talked about AARP briefly, and yes, they stopped the age increase at 75. However, when I said all companies price them based on age and zip code, AARP throws another one in there, and that's when did you get your Medicare Part B. So if you've had Part B more than 10 years, their rate goes way up. And most people get their Part B at 65. Now, if someone was on disability prior to age 65, let's say that they got their Part B when they were 50. Well, at age 61, now they're looking at a huge increase with AARP because they've had Medicare Part B longer. Does that make sense? And so it's kind of confusing, but it's just one of those little things that they put in there because they can, but that's how they work. So that's a factor. And again, my pricing engines take care of all that. So I don't have to remember it all, they do. And I act like it's me, but it's not.
There you go. So you said that with the Medigap plans, you're covered anywhere you go.
Mm-hmm.
If I have an Advantage plan, what happens if I need to go to the emergency room when I'm in Wisconsin?
Great question. So if you have an HMO, now again, Calaveras doesn't have an HMO right now. Tuolumne and Amador do. But if you have an HMO and you go to the hospital or a doctor, doesn't even have to be a hospital, emergency room, if it's a true emergency, it is covered. Now, whose definition of emergency do we use? Not yours and not mine. It's theirs. So it's life-threatening is what they deem it. Okay, so that matters. And so if you're in Texas visiting friends and you're just not feeling well, who's your doctor? Let me go check them out. Let me go see them. If you have an HMO, you're paying for the whole thing. Go. You need to go. And it's not an emergency, go to the doctor, and you just understand that you're going to pay for the whole thing. If you have a PPO, like the two in Calaveras right now, you can go to an out-of-network doctor. You just pay more for it, but you're covered. Okay? Whether or not it's an emergency room visit, well, you'll still pay for an emergency room visit. It may or may not be an emergency, and that's okay because you're still going to pay for the visit with the PPO. But you are covered. An HMO, you're not. If you say, I broke my arm, let's go to the emergency room, it's not life-threatening, unfortunately. Now, don't quote me on this, but I don't believe it's an emergency. I think they'll suggest you next time should have gone to urgent care or something like that.
Where they're gonna send you to the hospital.
And that's okay. If they send you to the hospital, that's different.
Okay.
That's not your choice. It's
Theirs.
their
Okay, that makes
professional recommendation that you go to emergency, and then by all means you go.
Yeah.
But I would rather have them tell me than me
Exactly.
do it and not get covered.
Yeah.
And so yeah, there's a way to circumvent certain things. Yeah.
But you have to know that ahead of
Yeah.
time.
How does a general person
I know.
supposed to know these things?
They don't.
Yeah.
They don't. That's a great question. A lot of people think, oh, I'm turning 65 soon. I got it figured out. I'll just read the book. And it's really, really confusing, especially if, let's say, your spouse is still working and they have coverage and you don't know if you need to pay for Part B. And so I have a series of questions that I say, okay, here are your list of questions that your spouse needs to ask them soon. Usually it's, within the next couple of weeks because they're turning 65 next month. And so there's the questions like, do you require my dependent to take Part B when they're first eligible? That's up to the company. It's not up to you. And Medicare doesn't care. It's up to the company. If the company says, yes, we require them to take Medicare, which means Medicare would become primary, Or no, we don't require them. That's a big deal. You should know that. 'Cause some people pay $164.90 a month and they didn't need to.
So, if both spouses are working and both have coverage, so my husband and I have dual coverage, my husband just turned 64. Anyway, we're getting there. I'm right behind him. So like I'm like freaked out about all this. Like, oh my gosh, we have to start thinking about, we will not be retiring for a while.
Okay?
So are there things that we still have to do even though we will have medical coverage?
So again, I would ask both employers, HR department, when he's 64 and a half, and I wouldn't worry about it until then because things change.
Thank you.
Yeah, yeah. Put your worry hat away. Yeah, 64 and a half, you start asking, do you require me to get Medicare when I become eligible?
Okay.
That's question number one. If they do, then you then say, what are my options when I turn 65 and I have Medicare? Sometimes they offer senior plans and sometimes they don't, depending on the company. They don't have to. And so then, once you're armed with which plans are available within the company, then you call me and I share with you what your options are outside of the company. And then you choose.
Your card will be one that I will not lose.
Okay, just put me in your phone. That's all I ask. Yeah, so Medicare is very complex. I study it every day, and then it changes because another year comes around, and so that's always fun for me. Yes.
I have one more question.
Mm-hmm.
All right, so I am experiencing numbness in my left arm. I decide I need to go to the emergency room, and then they tell me that my arm's done because there's a pinched nerve in my shoulder.
Sure.
So that wasn't really an emergency.
That's not up to me.
So
It's not
then-
for me to decide.
So then the company that I'm insured with could
The insurance,
possibly say, well, that's too bad. It wasn't an emergency. You're just
yeah.
not.
So okay, so let me clarify that. If you have Medicare and a supplement, Medicare decides and the supplement follows. Medicare decides that.
Okay.
It also depends on how the doctor codes it.
And
Okay.
if you're within network, that's helpful, correct?
Very.
Yeah.
Now, if you have a Medigap,
Oh, you're talking about you're still in Wisconsin.
I'm still in Wisconsin.
Okay.
I'm having a really bad trip.
yeah. So remember, with a Medigap plan, there's no in-network, out-of-network. You just go. However, they follow Medicare. They're supplemental to Medicare. Medicare's the brain. The Medigap plan follows. They don't decide. They follow what Medicare says. Okay? So my joke is if you want to go in for a nose job, Medicare's going to say no, that's cosmetic. Supplement's going to say no. If it's because you have a deviated septum because you've got something medically wrong there, Medicare's going to say yes, and the supplement will follow. Okay? So that's important to understand.
That is good to know.
I had a situation the other day where a client called me in July of last year. He had a knee surgery, and he was covered under his employer plan at the time. Well, in December, he had a follow-up appointment. In December, he had a Medicare Advantage plan. In December, he went to the follow-up appointment and now is liable for the entire appointment fee because his surgeon that did the surgery in July is not in network in his Medicare Advantage plan because he has an HMO. And so he had two options. He could have gone to an orthopedic person within network, and that surgeon, that orthopedic person within network could have said, let me look at the surgery, let me look at the details, let me look at talk to that other surgeon, or pay out of pocket and and do a follow-up with the actual surgeon. And so that's what he did. He didn't realize he was doing it, but he's liable for the entire appointment, which evidently was pretty costly. But he's been fighting for a year and never called me. And so I clarified that for him, and I was like, He said, everyone's been really nice, but it's been a year. It's time, let's just pay it. But regardless, he was disappointed because he thought he was doing the right thing because he went to his follow-up from the surgeon.
Well, most people would.
Yeah, yeah,
That's a lot of work not to,
Yeah.
yeah,
for everyone, including the ortho,
right, right.
both
But
of them.
it depends on whether or not he wanted the surgeon or someone in network, but he couldn't have both. Yeah, so, yeah, it's just a understanding thing.
So before you go to the doctor for anything, call you up and say, is this guy?
No, Linda. You don't need to do that. If there's a question, first of all, your primary care physician's already been determined. And secondly, you can always call the number on the back of your card, whomever it is with, and confirm it. Usually a primary care, when you have an HMO, by the way, or a PPO, you need a referral to a specialist. And so generally speaking, a primary care person's not going to refer you to someone out of network. But it's your job to confirm that, not theirs.
And when they do have to do that, at least like through our plan at Adventist Health, our provider's really good about saying, I can't get you in for 3 months and you need to see someone right now. I'm gonna refer you out of network, is that okay?
Right. And if it's a
He's really
PPO,
good about that.
if it's a PPO, you're covered, you just pay a higher copay generally. And if it's an HMO, you're paying for the whole thing.
Yeah.
Although, I mean, I went to an HMO, a specialist, because there were no dermatologists within network, and it was covered because the primary care physician referred it. And so, yeah, that matters. So, yeah, we want their blessing anywhere we go. Okay. So let's see what else is happening in the Medicare world. The deductibles, of course, change. Part B deductible. Oh, here's a question that a lot of people ask. Did Plan F go away? And so Plan F did not go away if someone had Medicare prior to January 1st of 2020. They will always be eligible to try to get it. If they have had an F, they can keep their F. If, let's say, someone has a G and they say, you know what, I don't like that Part B deductible because that's the difference between the F and the G.
And what is the deductible?
This year, it's $226,
Okay.
and they expect it to stay about the same, but there's nothing in writing. Sorry?
That's for Part G or?
Part B as in boy.
Oh, but I
So-
thought you were saying there was
Plan.
160.
The Plan
I thought
G,
you said it was 164.
so great question. Okay, so Part B, there's something called a premium and a deductible. And of course, I didn't know either of these. I didn't know what they meant until I actually got my license and then started working it, even though I've been paying them my whole life. So the Part B as in boy, premium, that's how much you pay monthly. This year is $164.90. That's expected to go up to about $175-ish. That, you pay that monthly, and that's usually comes out of your Social Security check if someone's receiving Social Security. If someone has, so that's your original Medicare. A is free, B is at $164.90. If someone has a Medigap plan or a Plan G as in George, then outside of the Part B deductible, which this year is $226, it's an annual deductible, then you're covered 100% if you have the Plan G. So a Plan G is a beautiful plan, just like the Plan F is. Again, the difference between the G and the F is that Part B deductible. If someone has the F, they'll never pay the Part B deductible. And if someone has the G, they'll always pay the Part B deductible regardless of the cost.
And the Part B deductible was what?
This year it's $226.
So it's really not that,
It's not
And
that,
that's just each year?
it's an annual deductible, yes.
Annual,
And it
so-
changes every year.
Okay.
Yeah.
It's just like my health insurance, I think I have like a $500
Correct.
deductible
Correct.
that I have to pay before the insurance will kick in.
Correct, correct. Part B will always have a deductible. And Part A also has a deductible, and it's pretty ugly if someone doesn't have a supplement or Medicare Advantage plan to cover that deductible. You had a question?
I do. What about the donut hole? I heard that was gonna go away.
So the donut hole, otherwise known as the coverage gap, what she's referring to is that there's different stages of a drug plan, which is your Part D, if you have original Medicare, or it's within Part C, the Medicare Advantage plan. So either way, you have a coverage gap or donut hole. So this year, you have the stages of a drug plan are, there's a deductible phase where you pay part of the deductible, or the deductible, if a company is asking for it. And I say that because, again, there's 26 plans. Let's say that you have a plan, and let's say that you take a couple generic prescriptions. Some plans don't charge you that deductible for tiers 1 or tiers 1 and 2. So that means you pay a low cost for that low cost generic drug, and you're not going to worry about that Part D deductible. This year's $505 for the D as in David deductible. Some plans don't charge that deductible until your drugs are tiers 3, 4, and 5, the more expensive ones. And so after the deductible phase has been paid, then there's an initial coverage phase, and that is when you and the company reach a certain number. And then that number changes every year, and I want to say next year's $3,300 for both of you, but I could be wrong about that. And then you go into what's called the coverage gap, or the donut hole. And so you don't get there by generics. You get there because you've got Ozempic, and you've got Januvia, and you've got a lot of expensive prescriptions. The E word, the Eliquis, the heart drug, the very expensive stuff. That's when you get to the donut hole, or coverage. Technically, it's called the coverage gap. It's loosely called the donut hole. This year, if you reach almost $8,000, $7,800, then you go into what's called the catastrophic phase, and you only pay about 5% of your drugs for the remainder of the year, and then that starts over January 1st. Okay? Next year, the catastrophic phase goes away, and so once you've met $8,000, no more, you don't pay any more, you just get your prescriptions. In 2025, that's when the donut hole coverage gap is going to go away, and I believe that maximum you're going to pay, let me find my numbers to be exact. You'll pay $2,000 maximum in 2025 for your prescriptions.
Okay, that's what I was gonna ask.
For your prescriptions.
2,000?
Yes, in 2025. It's $8,000 in 2024.
And then when do we start seeing the drug prices that are being negotiated? When do we see the benefit?
Great question. So what I understand your question to be, and help me if I missed it, every year before October 1st, everyone gets what's called an annual notice of change. And so that says how much your premium's going to be next year, how much the different tiers are, and then if you know that you're tiered 1, you confirm that it's tier 1 for next year, and then you can see what your copay will be. That's when, and I have to send that to you before October 1st, because remember, October 15th through December 7th, you can change that drug plan. I will tell you, there is going to be a drug plan next year. Can I tell you this? Okay, I can't tell you that yet. It's very low cost. Very low cost. Now, it may not be the best one for you. It matters what you're taking. So don't just go there, because you might hate it. But call me. After October 1st, I can talk about some things, but there are certain things I cannot.
So what happens if you're a person like me? I have one prescription, I refill it every 6 weeks. I pay out of pocket because the insurance company would want me to they want me to split it up into 4 weeks, and I'm just not doing that, it's just easier, but anyway. So something happens halfway through the year, and now suddenly I need all kinds of drugs. And since I got the very lowest plan I could get, I didn't need anything, can I change plans?
Great question. Great question. The quick answer is no. So you have between October 15th and December 7th to change that plan. And let's say you take 1 or 2 or none, or low cost generics, and we put you in the plan that's best for you, knowing what we know. And let's say next July, you all of a sudden need 3 very expensive brand name drugs, and so you have a few choices. So first of all 26 plans have to have something in all categories, which means your plan has something that that will work for you, well, that the doctor will be okay with. Now, you have a few choices. You can appeal that decision, and you can say, the doctor can say, no, I want her to have XYZ drug, not ABC on your formulary. ABC is there, and it's equivalent as far as Medicare goes, but I don't want her to have XYZ, I want her to have ABC. You can appeal that, and the first one's usually denied, and the second one's usually accepted. Note that. Or, doctor can say, let's try the ABC drug. It's covered. So that's an option. Or you can pay out of pocket for the XYZ. So you do have some options, and that is regardless of whether Medicare Advantage or the original Medicare and a separate drug plan. Doesn't matter. As long as you have a drug plan, all drug plans have something in all categories.
And then does that, let's say my doctor said he wants me to have the more expensive.
Mm-hmm.
At the end of the year, when I can change plans, is my company gonna say, well, now you have to change the plan or you can't get this drug anymore?
So you're saying, let's say that year they honored your request. Absolutely, yes. You want to get a plan that works well with that drug, that is now working for you. Yeah, you cannot assume that they will continue that appeal.
Okay.
Yes, that's a great question.
Well,
Some people are taking such expensive drugs that you can go to the manufacturer and ask for a discount, and oftentimes they'll give it, but you can't assume that they will do it next year, ever. But many do offer a substantial discount if your prescription plan doesn't cover it, because they want you to take it. Okay. Any other questions?
This has been so informative.
Oh,
Thank
good,
you.
good, good. Well, my joke is I don't speak Spanish, I speak Medicare, because it's a foreign language. And I say that because a lot of people, I mean, if I were to go to another country, I'm intimidated because I don't speak their language. I ask fewer questions. You know, I don't want to look stupid. I don't want to do any of that. And I know that that's how many feel. And so it's important for them to understand that I understand that it's a foreign language. I understand you don't speak the language. And so I really want to slow down and really work through and walk through what your specific needs are, because everyone is different. And so there's not a one answer fits all. If your next door neighbor has a plan that they say is fabulous, it may not be fabulous for you. So please don't listen to your next door neighbor. I mean, because, you know, our thresholds are different. You know, if some say, I hate asking, do you take my plan? I hate asking what the copay is because that's so out of my comfort zone. I just want to know I can go to any doctor I want. And so again, it's your threshold for stress, your threshold for discomfort. It all plays, your bank account matters, and everyone's different. And so there's no bad answer, there's no bad question. You may not like the answer, but I'll give it to the best of my ability.
And I think sometimes, I've listened to high cap presentations and I've talked to you and I'm still learning. And there's questions that I asked today I wouldn't know I should ask.
Right, right. That's why I try to bring in scenarios, you know, from my clients, you know. Another question a lot of people ask is, because the Medicare Advantage plans are county driven, what if I move? And so if you move to Lodi in June, good news, you have a special election period for San Joaquin County. And so you're never stuck with a plan if you move. Now, you do have deadlines. You can't go past 63 days to be fully covered again. So that means call me before you move. And we'll set up a date, you know, but it's my job to know those deadlines. And so I do, but yeah, there are ways. If someone, here's a common question, believe it or not. So I said Part B is $164.90 for most people. I said that because if someone is a high wage earner 2 years ago, don't ask me why that's 2 years ago, but that's the way it is, then they get to pay more for their Part B. And it's substantially more depending on how much more they made 2 years ago. But let's say that you made a lot of money 2 years ago, you sold a house, or you were employed and now you're retired. Well, now your income's drastically different. You can appeal that. And so little things like that are really important when you were making a lot of money and now you're on Social Security. Even though you might have money in the bank, your income is what matters, not your assets. And so that matters. And so the best advice that I can give is find someone you trust, talk to your friends, and get them in your phone. There's a lot of me in San Joaquin County and Stanislaus and Sacramento, among other places in Southern California, and there's a few of me here in Calaveras and Amador and Tuolumne. And so find someone you trust.
I did, thank you.
Yeah, you're very welcome. I'll be at the health fair at the end of the month. And I have Medicare meetings throughout the county, throughout open enrollment, just to answer some questions. I don't sell ever, I educate. Because you're a big girl and big boy, you can make your decisions, but I educate.
I do have one more question.
Mm-hmm.
I recall you saying at the beginning, Part A is free, but then you said something about a deductible for Part A?
Yes, Part A has a deductible. So remember, Part A is hospital and hospice and skilled nursing and a few other things. Home health, thank you, yes. So Part A this year is a $1,700 deductible per period. It's not an annual deductible. And nowhere in this book will it show you what a period is, but I'll tell you. So a period is, because Part A is hospitals and a few other things, let's say that you go to the hospital and you get out March 15th. Well, a period is while you're in the hospital and 60 days after. If you go back to the hospital within 60 days, that $1,700 that you paid is still being applied. If you come back to the hospital in 70 days, you're going to pay $1,700 again. Unless you have a Medigap plan, Medicare supplement plan, that covers the Part A deductible, or a Medicare Advantage plan that covers the Part A deductible. Some people have nothing. They only have Medicare. And that's really who I'm referring to when I say that. Some people say, I just have Medicare, that's all I need. If you have no Medicare Advantage or Medigap plan, and you go to the hospital twice in 1 year and they're more than 60 days apart, you're going to pay $1,700 each time. Does that make sense? And so that matters. A lot of people say, I have VA coverage. I don't need anything else. And that's great as long as you're willing to drive. Sometimes, though, your dependent is the one that's driving because you're not well. That matters. And so you might want a Plan B if you can qualify for it. So let me make a note of that. If between October 15th and December 7th, and let's say you're a veteran, you can get a Medicare Advantage plan. And this year, they're very low cost. One is $30 a month and one's $56 a month for our, in Calaveras County, Medicare Advantage plans. And you can use it as a backup to that VA benefit. So that matters. If you want to supplement, you're going to be underwritten unless you're brand new to Medicare. The supplement is when I say, how's your health? What prescriptions are you taking? When was the last time you were hospitalized? However, when you're brand new to Medicare, you have a few months before you turn 65 and a few months after to get that supplement guaranteed issue. Doesn't matter about your health.
What's the difference between a supplement and an Advantage plan?
It's a huge difference. So the supplement, remember, you can go to any doctor. A supplement, if you have a Plan G, the only out-of-pocket you're going to pay for a doctor or hospital is that Part B deductible of this year, $226. Whereas a Medicare Advantage plan, you're going to say, do you take my plan? Are you in network? Are you out of network? And you'll have copays when you go to the doctor. Medicare Advantage plan also has what's called a maximum out-of-pocket. This year, one of the plans, maximum out-of-pocket is $5,700, and they go up to $10,000. And so that number is how much you'll spend in 1 year if you go in and out of the doctor's, the hospital. You have a really bad year medically. The most that you'll pay in 1 year is called that max out-of-pocket. Medicare Advantage plans have different maximum out-of-pockets. The supplement has none, because if you have the Plan G, for example, the only out-of-pocket you're going to pay is that Part B deductible of $226.
So why would you want Medicare Advantage versus a supplement?
Great question. The biggest reason is finance, money. The Medicare Advantage plan this year, the least expensive one is $30 a month. The least expensive Plan G for this area is probably about $140 a month, depending on the company. Now, here's another question that a lot of people ask me. What's the difference between a Plan G with AARP and Plan G with Anthem or Plan G with Physicians Mutual? And the answer is nothing, except the price and the customer service. Okay, so that's important for you to know. So great question, and that's when I do a Medicare 101 with you, when we sit down, when you're 64 and a half, or you're going to be 65 in a couple months, we sit down and I do what I call a Medicare 101, and I go over details of original Medicare, the drug plan, the supplement versus the Medicare Advantage plan.
And are you gonna talk about the customer service aspect of each company? Are you familiar with that?
I am, to an extent. AARP, which is United Healthcare, is a well-oiled machine. They know what they're doing. They have what's called a one-call close, which means if you call with a problem, their policy, if you will, their goal is to not hang up with you until it's fixed. That's huge. Most of my people are on AARP, so I take care of that for a lot of people. Physicians Mutual oftentimes offers the least expensive. They're also very good. They're not new. They're new to California a couple years ago. And so they've been gaining momentum. But again, they all want your business. And so they're all going to try to price it as competitively as possible. And then, of course, they have household discounts depending on which company and all that. Okay. So does that help get you started? You're going to call someone that's turning 65 soon? Say, I got a girl. Yeah, that's what I do. Okay?
Sure, thank you.
You are very welcome. Anytime.